All right, Dr. Angie Stower, I am going to show you as a physician how to do the mouth swab for a gonorrhea, chlamydia, and trichomonas test. And this is important in your patients that are non-traditional sexual lifestyles and probably in your high-risk teenagers and young 20s as well, because there are a lot of people who are using unprotected oral sex. And you want to make sure that you are checking their oral cavity because they can transmit that to the genitals. So you are going to use an Aptima swab, the orange one. It is just the same swab that you would normally use to do a genital swab. You'll use the same swab that you use and do it just like you would do for a strep test in the mouth. So you put the swab all the way to the back of the mouth, swish it around a couple times. The patient should probably gag with that. You pull it out and stick it right into the container and send it off. You can code it exactly the same way you're coding for the genital venereal disease, so venereal disease screening, or you can code it under high risk sexual activity. Both of those codes will typically work. If you want to separate the oral swab from the genital swab, you can certainly do that. That's probably the more technically accurate way to do it. But the fact is, you do treat all of those in exactly the same way, whether they're oral or genital. So you can use one swab, oral first, obviously, and then genitals second. Those are very easy instructions, but if you have any questions, remember Aptima swab, just like a strep test.